Hey everyone, Ting here, physical therapist with Physical Therapy and Balance Centers. We have a treat for you guys today because we're actually going to treat a real life patient. This is Kathie. Say hi to Kathie. She just happens to be one of the co-owners here, but she twisted her knee on Monday, had a little biking accident, and she planted her foot and twisted. So she's been getting knee pains and stiffness since Monday this week. We were going to treat her anyway, so we figured, you know what, we document it so you guys can see exactly what we do in a physical therapy clinic. So the key things we're going to do is, one, we're going to look at, use some of our diagnostic tools to try and figure out exactly what's going on in there. And based off those testing, what we're going to do is show you what we would do in the clinic to try and help with pain, with swelling, with healing, and hopefully make her feel a lot better after the end of the treatment. Okay, so one of the first things we want to determine is the extent of the injury, whether she actually has any ligament tears, any strains, and the way we're going to do that is with some ultrasound imaging. So as you can see, we have an ultrasound tool here that we can allow us to look into the soft tissue, look at the ligaments, look at the meniscus, look at the tendons, and see exactly if we can figure out what's going on. So we're going to do a live ultrasound, and then hopefully we'll show you the results once we get done. Okay, so with the ultrasound tool that we used, we found potentially Kathie has some swelling on the top of the knee or in the quadriceps tendon, as we saw. She may have strained the quadriceps tendon up there. She also had a little bit of sprain on the medial collateral ligament, so we're going to focus some treatment there. And also on the back of the knee, we found that she has some swelling there, what people know as a Baker's cyst. So we'll focus on some of that as well. So one of the first things we want to do is work on the fascial system, because when you injure yourself, the fascial system gets tight and kind of dehydrates and adheses or gets stuck to the tissues around it. So one of the first things we use is a scraping tool, and we use the edge tool, and I'm going to focus some treatment along the medial collateral ligament here itself. Just a little bit of cream, we don't want too much, because the tool actually gives us feedback in terms of what the tissue quality is like. And we're going to focus on some of the areas that we're going to treat for around about 4 to 5 minutes, just to get, one, the fascial tissue nice and loose, two, encourage some circulation going there, and hopefully this will feel nice and comfortable for Kathie as well. Okay, so from there what we're going to do is we're going to use some of our cups, or what we call myofascial decompression. And what this does is it allows us to decompress the areas that are injured. Again, when things are injured, they're going to form scar tissue, and what we don't want is that scar tissue to form down like in a bad way. So sometimes what this can do is help that scar tissue unload and also encourage the circulation to flow into the area. So we already have some cream there, and I'm just going to pop this around the MCL, just nice and gently, because this is an acute injury. And we're also going to pop some along the quadricep muscle where she potentially has a little bit of a sprain or a strain right there through the quadricep tendon. So with, like I say, an acute injury, we're not going to get too aggressive with it, just nice light decompression of the area. And I'm going to leave this on for about a minute or two, just to encourage the tissues to decompress themselves, get the circulation flowing. Okay, so now that we've looked after the fascia, hopefully the fascia is going to be nice and loose. We're going to get in there on the actual ligament and the muscle itself to try and sort of encourage the healing process. One of the tools that we use a lot here is called the Miracle Wave. What it is an acoustic wave, otherwise known as a Radial Shock Wave as well. And they found that when it gets onto a tendon, it can really help speed up the healing process, break down any scar tissue, and just allow it to heal faster. So with an acute injury, again, just happened on Monday, which was 3 days ago. We're not going to get too aggressive with this. I'm going to keep it nice and light, and just try and encourage and get that tissue to really kick in the healing process. Okay, so after we've used the Miracle Wave, what I want to do is just speed up the internal body processes to try and encourage the natural body reaction to get the chemicals down there to heal. And the way we do that is with cold laser. We have a class 3 laser here, and we're going to put it right over the MCL, right over the quad tendon, and treat that for around about 2 or 3 minutes on each section. All right, so what we're going to do next is, now that we've treated the knee itself and helped loosen the fascia, encourage the healing process. We're going to try and protect Kathie's knee because we know she's not going to be laying like this all day. So we do that through using some kinesiology tape. Our personal favorite here at Physical is rock tape. So the first tape here I'm going to do is control the kneecap. And I'm just going to sling the kneecap or allow it to like roll towards the inside, because kneecaps tend to want to go towards the outside. So this hopefully will help control the kneecap and help that that quadricep tendon injury. The MCL runs right on the inside of the knee, so I'm going to put a bit of tape right to support that medial collateral ligament. With this tape here, I want to put it on pretty good stretch just so we support that ligament a little bit. And the last piece of tape we're going to do is we're going to sling around the knee to unload it a little bit. Plus we're going to help facilitate or get the muscle of the quadricep working a little better, particularly the inner muscle, which we call the vastus medialis muscle. So that'll help facilitate that. Alright, so what we're going to do is have Kathie flip over to her back and stomach, and maybe do some of the stuff on the back, and then we'll see how she feels. Feels better. So knee strength, yeah, that's good.